One day, your cat may no longer run to the door to greet you like always. They lie quietly in a dark corner, eyes dull, breathing hard, small signs that make your heart clench to see. None of us wants to think about that day, the day we have to say goodbye to a dear four-legged friend. But if that day comes, are you ready to notice the subtle signals your cat is trying to send? Can you stay by their side and soothe them on the final stretch? If you love your cat, stay with me. The next few minutes may not be easy, but they matter deeply. Don't forget to hit subscribe to journey with us through meaningful shares about pets. Especially at the end of the video, I'll give you a quick checklist of what to do and a sincere message, a small gift to help you and your cat get through the hardest moment. No cat guardian wants to face this loss, but the truth is that a cat's lifespan is limited, and we will eventually go through it. The problem is that many signs a cat is nearing death are easy to miss or mistake for normal aging or minor illness. For example, a cat's loss of appetite or weight loss might come from a treatable condition, or it may be an end-of-life sign. Only a veterinarian can distinguish this clearly. If you watch closely, you'll notice that dying cats often stop eating and drinking, grow weak, and lose significant weight. Some, by instinct, seek a quiet, hidden place to spend their final moments alone. Recognizing these subtle signals early is the last loving act you can do for your cat. It allows you to comfort them, provide care and pain relief in time so they can pass peacefully, and it helps you avoid the regret of not being there with them to the very end. One, withdrawal and unusual hiding. Your once clingy meow now disappears into closets or under the bed. This isn't sulking, it's survival instinct. When weak or ill, cats seek quiet, dark, safe places to hide. In the wild, concealing weakness helps avoid predators, and our house cats still carry that instinct. Emotionally, sudden avoidance can sting. It may feel like rejection. Remember, your cat isn't pushing you away. They love you. They're just exhausted and seeking the safest spot they know. Action. Gently look for your cat in hidden nooks, under beds, inside wardrobes, dark corners. Place a soft bed, water, and easy-to-eat soft food nearby, and dim harsh lights. Sit close, speak softly in a calm, low voice so your cat knows you're there. Don't force them out or disturb them if they don't want to move. Red flag. If your cat hides all day and won't come out, even to eat or when called, health may be in serious decline. Lan's cat Molly always curled beside her at night, but in her final days, she stayed under the sofa. Though it hurt, Lan sat by the sofa and whispered to her. Now and then, Molly let out a faint meow, her way of saying she still felt Lan's love, even as she faded. 2. Loss of appetite, weight loss, and not drinking. Your cat's favorite fish goes untouched. The water bowl stays full from morning to night. In late-stage illness, appetite often vanishes. Cats may refuse both food and water. The result is dramatic weight loss. You may see ribs and hip bones and dehydration, which further drains energy. Emotionally, watching a beloved cat grow thin and ignore food you lovingly prepared is heartbreaking. You can feel helpless when your love offering in a bowl is refused. Action. Warm the food or add a little tuna water to boost aroma and entice eating. Prioritize soft, wet foods that are easy to chew and swallow. If your cat won't drink, use a small syringe to slowly drip water into the corner of the mouth, a little at a time, with the head slightly lowered. Avoid forceful pouring. Aspiration can cause dangerous pneumonia in cats. Nam's cat Tom loved pâté, but in his last days, he lay still, unmoved by even the most fragrant plate. Desperate, Nam slowly syringed a little warm broth into Tom's mouth. Feeling Tom's ribs under his hands, Tears fell, but at least Tom didn't pass in hunger. Nam did all he could, so Tom knew he was loved. 3. Exhaustion and decreased activity. No more morning leaps to the window to watch birds. Now your cat curls up all day as if every bit of strength is gone. Near the end, many cats sleep most of the day. Muscles waste, joints may degenerate, and movement becomes clumsy and difficult. That once bouncy ball of energy is a quiet, still presence. The house feels emptier, a sign that goodbye may be near. Action. Help conserve energy. Place the litter box, food, and water close to your cat's resting spot so they don't have to climb or travel far. Use a small ramp if they still want the sofa but can't jump. Line the bed with soft blankets. Support the head and limbs with cushions to reduce soreness. If you suspect joint pain, ask your vet about safe pain relief to keep your cat comfortable. Red flag. If your cat can't stand to use the litter box, urinating or defecating where they lie, or repeatedly collapses after a few steps, the body may be critically depleted. Speak to your vet promptly. Hong's 17-year-old cat once climbed cupboards like Tarzan. In her last weeks, a few steps left her panting before she sank to the floor. Hong laid baby pads around the bed so accidents wouldn't soil her. Each afternoon, she carried her outside to feel a touch of sun. Just minutes, but the cat's eyes sparkled as if to say, "Thank you."
4. Unkempt coat and unusual odors. That silky coat turns dull and matted. You may even catch an unfamiliar, unpleasant smell from your cat's body. When cats feel ill, they often stop grooming. Fur mats, skin dries and flakes. In long-haired cats, tangles can form around the tail and rear. As organs fail, toxins and waste build up, causing odd odors on breath and skin. For example, advanced kidney failure can give the breath an ammonia scent, while diabetic complications may make breath smell sweet and fruity. Emotionally, seeing a once proud groomer neglect their coat is painful. The strange smell can alarm you, a stark signal of internal decline. Action. If your cat allows, assist with hygiene. Wipe gently with a warm cloth, especially soiled areas from incontinence. Use a soft comb to stimulate circulation and comfort. Keep the resting area clean. Change bedding often to reduce odor and bacterial growth. Absorbent pads or towels beneath the body help keep them dry. Red flag. If you notice skin sores or infection from prolonged lying or urine scald, contact your vet for wound care guidance to prevent sepsis. A reader once wrote, "Mina developed a strong, indescribable odor a few days before she passed, sharp and fishy. I didn't realize it was a warning. By the time we reached the vet, it was late. She died 2 days later. I wish I'd recognized it sooner." Trust your instincts. If you see or smell anything unusual, check and ask your vet. 5. Labored breathing and weakening heartbeat. Petting your cat, you feel the chest flutter fast and strangely. Sometimes they pant with an open mouth. Press an ear to the chest and the heartbeat may seem very slow and faint. In the final stage, the respiratory system weakens. Breathing can be rapid and shallow, then slow, even pausing for seconds before resuming. The abdomen may heave with each breath, a sign of severe effort to draw oxygen. The heart rate may also drop below normal. A healthy cat's heart beats about 140 to 220 BPM, but near the end it can fall under 140, becoming irregular. Poor oxygenation and circulation make the body grow cold, especially the limbs. Emotionally, watching these gasping breaths can be terrifying and agonizing. Each wheeze and spaced out beat feels like a countdown you wish you could halt. Action. Open mouth breathing with neck extended and strong abdominal effort means your cat isn't getting enough oxygen. This is an emergency. Keep them in a comfortable position, slightly elevate the head, improve airflow with a fan or open window, and contact your vet about oxygen support or heart supportive medications. Red flag. A resting respiratory rate under 20 or over 60 breaths per minute is an alarm. Call your vet immediately. Feng recalls the last night with Lucy. I woke to harsh, rattling breaths. She was open-mouthed panting, neck stretched. I panicked, wrapped her in a warm towel and rushed to the ER, whispering that I was there and she should hold on. She didn't make it, but she passed in my arms, knowing she was loved. Behavior changes and loss of bodily control. Have you noticed odd behavior? An independent cat may suddenly cling to you all day, craving your warmth. Another may grow irritable despite a gentle nature. Near the end, mood can swing, staring blankly as if lost, then yowling at night for no clear reason. Possibly cognitive decline, similar to human dementia. Bodily control also fades. Incontinence at the resting spot, or even seizures if the illness affects the nervous system. Urine may turn very dark. Stools can be loose with mucus or blood, as organs like the liver and kidneys fail. Emotionally, these changes can be bewildering and devastating. It can feel like you're losing the cat you knew as personality and habits shift. Action. Above all, be patient and keep them safe. During a seizure, gently move your cat away from hard edges, protect the head, stay nearby to comfort, and don't restrain tightly. Time the episode. If it lasts over 5 minutes or occurs in clusters, go to emergency care at once. For hygiene, line the bed with soft towels or absorbent pads. Clean frequently and never scold for accidents. If your cat wanders and cries at night, leave a soft nightlight on and sit nearby to soothe with calm petting. Your steady presence can be the best medicine for a frightened cat. Red flag. Large amounts of fresh blood and stool or prolonged unresponsiveness demand urgent veterinary intervention. There may be internal bleeding or severe neurological injury. Hung remembers a brutal night. At midnight, Bong had a violent seizure, paws scrabbling wildly. I broke down in tears and held him close once it ended. A few hours later, he took his last breath. The pain was unbearable, but I'm grateful I stayed, whispering that he wasn't alone. Did you know? From a scientific standpoint, cats don't truly understand death the way humans do. Their survival instinct is razor sharp, but they don't know in advance or choose their own passing. Instead, a cat's behavior is driven purely by bodily sensation. When exhausted or in pain, they simply seek a safe, quiet place to feel less discomfort, an instinctive reflex. Also, many of the signs above can overlap with symptoms of serious but potentially treatable illness. For example, weight loss or increased thirst can also indicate hyperthyroidism or diabetes in cats. So when you notice anything unusual, don't jump to the conclusion that your cat is dying. Take them to the vet to get an accurate diagnosis. There may still be hope for treatment. If, unfortunately, the vet confirms your cat is in the final stage, understanding the science can help you stay calm. As the organs gradually shut down, they cause specific outward changes. Toxin buildup from failing liver or kidneys can produce unfamiliar body or breath odors. Diminished temperature regulation makes paws and limbs grow cold, and cats instinctively seek warmth. Most importantly, your cat doesn't want to leave you, and evidence suggests they still feel safer when you are near. Their heart rate often stabilizes in their guardian's presence. Knowing this, you'll realize there is still so much you can do. Medical care, pain relief, and steady, loving companionship, so your cat's final journey is less painful and never lonely. Myth 1. Cats know they're about to die, so they wander far away to die alone. Reality. Cats actually don't know they're dying.
When they're very weak, they often hide in enclosed, quiet places and withdraw. But that's instinct to find safety when ill, not a deliberate choice to leave you. In fact, most severely sick cats stay close to home rather than roaming far. They choose familiar spots like under the bed, inside a closet, or a tucked-away corner of the yard. If your cat goes missing, search every nook around the house first. And if your cat passes in a hidden place, it isn't your fault. They weren't abandoning you. They were following an ancient survival script. Myth 2. Just let a cat die naturally at home. Don't intervene. It hurts less than going to the vet. Not at all. Doing nothing can mean prolonged, unnecessary suffering. Many unassisted deaths involve labored breathing, falling body temperature, and extreme weakness that can stretch on for hours, highly stressful and painful. With veterinary care, a cat can receive pain relief, fluids, and other support for a gentle passing. When recovery isn't possible, humane euthanasia under veterinary guidance is a compassionate act. It prevents a drawn-out, distressing death. As one veterinarian put it, simply letting nature take its course can leave a cat in avoidable pain. The decision is yours, but don't let fear of deciding prolong your cat's suffering. Consult your vet early and prioritize your cat's peace. Myth 3. If a cat is purring, it's fine and happy, so it can't be hurting much. Reality. Purring doesn't only signal joy. Cats also purr when in pain or afraid to self-soothe. Many dying cats purr steadily, not because they're okay, but because the vibration helps them cope. Don't let purrs fool you. Assess the whole picture: appetite, breathing, hiding, mobility, and other symptoms. Purring often means a cat needs comfort, not that it isn't hurting. If purring appears alongside worrying symptoms, step up monitoring and care.
Ignoring early signs. Many people assume an older cat's reduced appetite, extra sleep, and slowing down are just age, and they miss the first warning signs. Fix: don't be complacent. If you notice any unusual change, eating less, hiding, weight loss, etc., take your cat to the vet right away. Early detection of disease or age-related issues lets you plan appropriate care and may even extend life if treatment is possible. Self-medicating or delaying care. Some guardians fear bad news and hesitate to see a vet, or they give over-the-counter meds at home. This can be dangerous and may waste a crucial window for treatment. Fix: always consult a veterinarian before giving any medication, especially painkillers or sedatives. Cat dosing is not the same as human dosing. If the situation is urgent after hours, call an emergency clinic. Don't let fear stall you. A vet can tell you whether your cat is still treatable. Even if not, they'll guide you in reducing pain and distress. Force feeding or watering the wrong way. Seeing a cat refuse food, some people try to force large amounts of milk or porridge. This can cause choking and aspiration pneumonia. Fix: if your cat won't eat, offer tiny portions. Choose soft, easy-to-swallow, aromatic foods to entice them. Feed by hand or a small spoon in little bites. For water or milk, use a small, needle-free syringe to drip a few drops slowly into the corner of the mouth, keeping the head slightly lowered to prevent fluid entering the lungs. Be patient and offer small amounts several times a day, rather than forcing a lot at once. If appetite remains poor, your vet can prescribe stimulants. Don't overforce. Not creating a comfortable resting setup. A frail cat that still has to climb as before, high-sided litter boxes, beds on high shelves, will struggle. Many guardians overlook this. Fix: rearrange the space for an ailing cat. Set up a quiet, warm resting corner on the ground floor so stairs aren't needed. Provide a low-entry litter box and place food and water near the bed so they're easy to reach. In busy or noisy homes, ensure a private, calm area. Small adjustments save energy and reduce stress. Leaving the cat completely alone. Thinking the cat wants to be alone, some people avoid going near during the final days, afraid of bothering them, leaving the cat lonely at the end. Fix: even if your cat hides, your presence still matters. Sit nearby, even a few steps away, so they sense someone familiar. Speak softly or simply be there so they don't feel alone. If you can, don't let your cat pass away without you. Your presence greatly reduces fear. Scolding when accidents happen. Loss of toileting control or soiling the bedding can be upsetting, and some people scold the cat. Fix: remember, your cat doesn't want to be dirty. Illness took away control. Never shout or punish. Prepare the area. Line the resting spot with absorbent pads or old towels and change them often. As you clean, reassure them, "It's okay, I'm here." Your gentleness prevents shame or fear and keeps the home cleaner. Neglecting grooming. Some think a sick cat doesn't need grooming or hygiene, leaving the coat tangled and dirty. Fix: gentle grooming can bring real comfort. If your cat still enjoys it, use a soft comb to lightly brush, stimulating the skin and removing loose hair. Use a warm cloth to wipe eyes and nose if there's discharge. Keeping the coat clean and dry reduces itch, prevents bacteria, and makes cuddling pleasant. Not managing pain. Some guardians fear pain medication or refuse euthanasia out of love, even when the cat is suffering, prolonging pain needlessly. Fix: talk to your vet about pain control and end-of-life or hospice options. There are safe analgesics for cats at proper doses that help them sleep and hurt less. If both you and your vet agree the suffering is severe and irreversible, humane euthanasia can be the final gift, allowing a quick, peaceful passing and avoiding a long, agonizing decline. Don't prolong life only to satisfy your own heart if that time is filled solely with pain and fear. Not preparing emotionally. Avoiding the topic means that when the worst happens, some people collapse and can't do what their cat needs. Fix: as painful as it is, prepare yourself. Learn, as you're doing now, about signs and care for a dying cat. Talk with your vet about a plan, whether euthanasia may be needed, and how you'll handle remains. Consider keepsakes, like photos, a paw print, or a favorite toy ahead of time, so you won't have regrets. Preparation helps you stay calm and make cat-centered decisions. Not saying goodbye. Some can't face the final moment, looking away during euthanasia or leaving the cat alone in another room at the last breath, later regretting they never voiced their love. Fix: try to be present to the very end. Stroke them, meet their eyes, and say what's in your heart. "Thank you. I love you so much. Don't be afraid." Your cat may not understand every word, but they will feel the love and peace in your voice. Many people cope better afterward because they have no regrets. They were there, they said "I love you," and they parted with all their love. By now, you've walked with me through the signs, the myths, and the common mistakes. I know this topic pierces the heart of any cat parent. If you're going through this journey or have been through it, remember, you are not alone. I've been there too. My cat of 15 years grew weaker in his final days and passed in my arms. I still remember that last night, holding him and whispering, "I'm here. It's okay, my love." He looked at me, blinked softly, and I believe he knew I was there. Then he slipped away gently in his sleep, not alone. That memory became my greatest comfort as I healed from the loss. A quick checklist: what you can do right now for your beloved cat. Key signs to watch: withdrawal and hiding, refusing food and water, weight loss, lethargy and sleeping much more, neglecting grooming, labored breathing, unusual behaviors. Timely actions: take your cat to the vet as soon as you notice concerning signs. A vet will identify what's going on, whether treatment is possible, and guide appropriate care. Prepare an end-of-life plan: medications, fluids, humane euthanasia if needed. Daily care: create a quiet, warm, comfortable resting area. Place food, water, and a low-sided litter box close by. Keep everything clean.
pads, fresh towels, and gentle warm cloth wipes. Monitor breathing rate, heart rate, and body temperature. Cold paws and limbs are a worrying sign. Emotional support. Be physically present as much as you can. Your presence is the most precious medicine. Pet gently and speak words of love so your cat feels safe. Stay calm and soft-spoken. Cats sense our emotions, and your steadiness helps them feel secure. Support and community. Share your feelings with family, friends, or a cat lover community. You don't have to carry this pain alone. Many people understand and will listen. Finally, remember that you have given your cat a life full of love. Even though it's time to say goodbye, that love doesn't end. It stays in your heart and in the beautiful memories you shared. Be proud that you cared for your cat with all your heart. If these thoughts helped, please share this video with someone who needs the same comfort. Leave a comment with your story or a message to fellow cat parents. We'll build a community of support and empathy together. Don't forget to subscribe so we can keep walking this pet-loving journey side by side. Thank you for staying with me to the end. Our team includes a veterinarian. If your beloved cat shows any unusual signs or worrisome symptoms, please leave a comment below and we'll take a look and support you as soon as possible. In an emergency, please take your little one to a clinic immediately.